For a little bit more on this story, we're now joined by Zambian journalist Arthur Sikopo. Arthur, good to talk to you. Thanks so much indeed for joining us. This number is horrific.
Thank you so much for having me, Peter, as always, talking about issues happening down here. Indeed, this number is quite horrific. When you look at these deaths, we're talking of 100 newborn babies in a week. Then when you multiply by 52 weeks, obviously we're talking of 5,200 somewhere there, which is a very huge number. And it's good that this information is coming from the minister herself, who is responsible for health in the country, and hoping that she would step her foot down and see where the problem is. Of course, we are being told that those health personnel that attend to this, to some point, they act in errors at some point, they act in omissions, and all those facts. So we hope to see that since it's coming from her as the Minister of Health, we hope to see that she puts something which will correct that particular incident. Of course, we're talking of 100 newborn babies, and of course we're talking of 10 to 15 mothers who also die every week out of complications during childbirth and immediately after childbirth. Of course, I think this is not so new to. It might not be so new to many Zambians. I think we've heard of reports in certain health facilities where people are complaining of being neglected. Just recently, I was conversating with a colleague who, in fact, even went as far as informing the Ministry of Health what was obtaining to a person that she knew. She gave birth, then after they discovered that she was positive for COVID-19, she was told to go and isolate and leave the baby at the hospital, and she had to push that issue and even reach to the extent of informing the Ministry of Health, and that is when they came in and just intervened. So those stories, I think, are not new to many Zambians that follow health issues in the country. We've seen a number of those stories are going on. So those numbers, of course, they're quite frightening, but it is something which is not so new to those that follow health issues in the country.
Has this rate been increasing over time? My mother was a nurse in Zambia in the 60s, and it seemed as if it was a completely different story back then. So has it been getting worse over time? What's the story?
Peter, I must say that I should think that it has been increasing over time. Back in the years, I also remember the time that I was young. I think the issues of neglect, or the issues of errors, the issues of omissions, I think were not so known, were not so pronounced. But these days, especially with maybe social media is maybe pushing it so much to be known, because these days, whenever anything happens, people of us would rush and vent those issues on social media. So social media is exposing these things quite a lot. And I think they're also probably increasing also in terms of their occurrences. And of course, the population increasing, obviously, other factors also are increasing. So it only remains to those that are in authority to see to it that they look at these issues holistically. And we've seen certain instances where those in authorities would not want to believe patients, would not want to believe those that have been that few they've been neglected in these health facilities. So we only hope that the health authorities would look into that and just pay that critical ear to that mother who is in that ward, in that maternity ward, that newly born baby, probably whose mother has just died. We hope that the authorities look into that.
I know that in Zimbabwe, one of the issues over time has been no new infrastructure, particularly around maternal health, have been built. What's been the story in Zambia? Has there been investment in health facilities so that some of these complications don't happen?
Well, investment in the health sector has been there, has been going on, and we see a number of health centers being constructed. We've seen big hospitals being constructed in the countryside, and of course, just here in Lusaka, we've seen refurbishment and just improvement of some of these health facilities, such as Levi Mahasa General Hospital, which has been upgraded and even put a medical school just behind there. So these facilities have been increasing, and of course, in the past, I think maybe 10 years, we've seen, of course, a sharp increase in terms of health facilities in the country. But I think one thing is that these are just general health facilities. So certain components of the health sector are missing in those health facilities. Of course, there are other facilities that have not been completed. We've been seeing civil society organizations petitioning the government at the point that the Patriotic Front government 10 years ago was coming into power. They promised to build 650 health posts. And I think as late as last year, I think maybe they only reached maybe 550 somewhere, 450 somewhere, 500 somewhere there. And that is where they reached in terms of completing some of these. But of course, the building of these facilities has been there, but I think the facilities need to have all those facilities that are specialized, say for maternity, specialized maternity ward and all that.
All right, so if a lot of these cases, and this is what the minister says, are because of mistakes, maybe even negligence, is there any avenue for compensation for women who've lost their babies because they died because of medical malpractice? What's the culture in Zambia in terms of how families can get some compensation if it is allowed for?
Yes, Peter. One can, of course, claim for compensation, but of course, it will be they have to prove that this and this particular thing happened, or this and that particular thing happened because of maybe neglect, or because of maybe some human error, or because of maybe some omissions. So yes, somebody can go maybe and maybe claim in terms of maybe putting up some legal suit, but it would depend on how they have to prove that particular case. And mostly in our setup, usually some of these cases take quite long. Some of these court cases take quite long. So people obviously, some of them probably could just be discouraged in terms of going to file some legal suit to just try to follow up on their deceased, maybe a parent or their a sister and maybe the siblings. So it will be quite maybe difficult for one to pinpoint exactly. But of course, it coming from the minister, she of course has information, and she of course knows that these things happen, but it will be a burden of proof in terms of one has to prove indeed that it was omissions or it was errors from these medical personnel that attended to this particular person that died.
How does the minister know that 100 babies are dying each week because of mistakes?
I think they follow what the records which they have in terms of the number of people that have died, and obviously it doesn't just end there. Obviously they have to investigate what led to this particular patient dying, or what led to this particular infant, of course, dying just after maybe giving birth, or some more maybe just maybe a few hours after being born. So I think they carry out some of those investigations just within themselves, and we only hope that there is some punishment, I think, to those that are found wanting in terms of the health personnel or the nurses or those that are working around the health facilities and helping our mothers to deliver. So I think it is based maybe on their investigation after a person dies or after an infant dies. Obviously, they have to investigate and see to it that or see what could have led to the death of that particular person or infant.
Has the minister indicated how she's going to try and turn things around?
The only assurance that the minister gave, or the only way that the minister gave, was that a government will not allow such a situation to continue, and she pledged that, of course, enough infrastructure will be put up. Of course, also the employing of health workers in the country. The current administration of Hakainde Hichilema, which is just about 5 months old in power, has promised to recruit healthcare workers and, of course, other workers such as teachers and others. I think the total number is somewhere around 41,000 to be employed, and I think from that they should be employing, I think, about 10,000 that will go into the health sector. Of course, there's been this debate to say that they want to start by employing those that were working voluntarily, and that came from the minister, that those that were working voluntarily are the ones that are first supposed to be employed before they get other people that are not yet working in the system. So the current government has put in those measures of employing healthcare workers that would help. And of course, people who hope that with the employment of these healthcare workers, the system will improve and such numbers will reduce. And of course, if facilities are well equipped with all those equipments that are needed in terms of proper healthcare for our mothers as they give birth, and of course the babies as they are born, things obviously will have to improve. And that is the assurance that the minister gave in that regard.
All right, Arthur, we're going to have to leave it there. Thank you so much indeed. It's great talking to you. Zikomo kwambiri usiku wabinu.
Zikomo kwambiri and mucho mebwino Peter.
Thank you. All right, that's one of our regular contributors from Zambia, Arthur Sikopo, talking to us about the fatality rate with the children because of mistakes. 100 babies every week in Zambia are dying, which is a tragedy. 15 women as well dying every week in Zambia at this time.